So Richard has had dental implant treatment here at the practice, and as part of the treatment we have a big focus on gum care here, and it's National Gum Disease Month, and so they asked us if we would put together a video. So Richard, what I thought I would do is just show you some pictures of gum disease, how it happens, and what we can do about it.
Yeah.
So this is a picture of gum disease and how it progresses. So as we eat and drink, we all get plaque on our teeth, bits of food, bits of bacteria, and they lodge on the tooth near the gum line.
Yeah.
Your body defences react to that dental plaque, so you make an immune reaction. And in simple terms, it isn't usually the bacteria that are doing most of the harm, it's actually your immune system, and a lot of people don't understand that. So there is a genetic susceptibility, a family history, so some patients will find that their body doesn't react to the plaque and they don't get gum disease, whereas other patients can have really minor amounts of plaque and have a big problem.
Right.
So some people are more susceptible than others. But at the end of the day, if there's no plaque anywhere around your teeth, then you can't get gum disease. And if the plaque gets deeper, the gum reacts and starts to move away, and then the bone starts to get damaged underneath. So I've got a picture here to show, this is a cross section through a tooth. This is the ligament which attaches the tooth to the bone, and this is the gum. This is a healthy situation, and this shows the inflammation, bone loss in response to that plaque.
Yeah.
So what I wanted to do with that explanation is take you over to the chair and show you in your own mouth areas where we would like you to clean, to show you how to use interdental brushes, and also how to clean around your implant, because that's a question that people often ask me when I've had a dental implant, how do I maintain it? Yeah. And it's really important for the future. Whenever we're looking for gum disease, this is a blunt probe. I don't know if the camera can pick that up, but there's little bands on this probe and it's blunt. And when you think about gum tissue, there's always a gap between the tooth and the gum, a little bit like a fingernail. And if we can get in this first little silver band, that means everything's healthy and the gap between the tooth isn't very big. And if we can get into the black band, then that means things are unhealthy and there's a pocket between the tooth and the gum, and that pocket can harbour bacteria. So when we're looking around, we're very gently probing to see if we can get underneath the gum and in between. And in health, that will always be in the silver band for us. And what we're looking at here is that the gum health is immaculate, that that there's no plaque anywhere at the gum line, and that there's no plaque in between the teeth. And if there's any plaque in between the teeth, that can cause pocketing, bleeding and inflammation, and that's what we're trying to correct. We're disturbing our bacteria, not just on the outside of the tooth, not just on the tongue side of the tooth where the tooth meets the gum, but also in between the teeth. So as well as using a toothbrush, we're also looking for interdental brushes. And these are called interdental brushes. This is the make TP. They come in different sizes. And what we're trying to do is get a brush in between the teeth to disturb our daily bacteria, not just at the gum line with our toothbrush, but in between. So the front edge of this tooth and then the back edge of this tooth, and then we'd rinse this brush and then we'd move on to the next space. And what we want is the widest brush that will go through that doesn't hurt. And sometimes patients say to me, well, when I do this I get a little bit of bleeding, and if you get bleeding it means that you've not disturbed your daily bacteria in that area, and you would do it more, not less, because you won't do any damage. And when patients have a filling or a crown or a bridge or an implant, that will cause a plaque trap. You'll always have a little bit of a ledge, and so you're going to need to spend more time with each of those restorations in between each space. So this is a dental implant that Richard's had fitted here. His lip's a bit, so I need to be careful not to make any sore. So we'd have a brush in front of the implant and behind the implant, again the widest brush that we could get in. And then the last thing, this is a really good tip for dental implants, is what we call subgingival floss. So this is tape, it's a little bit wider than normal floss. And what you want to do is just pop it down through the back edge of the implant and then through the front edge of the implant. So what we have is a lasso, and if you imagine tying a shoelace, if you cross it over and just close up a tiny bit for me, which is then with a very downwards gentle direction, this will go right underneath the gum, and we're not cheese wiring here, you're just gently disturbing daily bacteria underneath the gum line, and that will give that dental implant immaculate health. And going forwards, that means that implant has a better chance of lasting a long time.